Hello everyone, welcome back to our YouTube channel. Today we have a fascinating research article that we want to share it with you.
That's right, it focuses on the dredging effects and safety of using EDTA combined with the C-pilot files and microultrasound on the root canal calcifications.
Well, this study was conducted by a team of researchers and we found the results to be quite interesting. So let's dive into the introduction of this article and give you an overview of what it entails.
The purpose of this study was to compare the effectiveness of the treatment methods used in each group. Various parameters were measured and recorded to evaluate the outcomes. The researchers assessed the root canal dredging time, the success rate of the dredging in different tooth positions and calcified sites, as well as the overall clinical efficacy of the treatment.
Exactly. By comparing the results between two groups that we will discuss in continue, the researchers were able to determine the advantages and potential benefits of using EDTA, C-pilot files, and micro ultrasound in combination for treating calcified root canals.
And that's just the introduction. In continue, we'll delve deeper into the methodology, result, and the conclusion of this article. So make sure to stay tuned.
The researchers divided the patients into two groups. The first group, known as research group, consisted of 64 patients who underwent treatment with EDTA combined with C-pilot files and micro-ultrasound, along with the use of ultrasonic instruments. And the second group, known as the control group, included 68 patients who were treated with ultrasonic instruments and C-pilot files only.
After the patients were admitted to the hospital, CBCT and routine full mouth examination were performed. This helped determine the location, number, root canal orientation, and curvature of the affected teeth. CBCT was used to assess the location and thickness of the calcifications in the control group.
In the control group, the root canal was explored using C-pilot files of different sizes. If the probe reached the deep part of the root canal or got stuck, it was rotated from side to side to continue the dredging process. Manual dredging with larger files was performed until a 15 C-pilot file was used for conventional root canal treatment.
In the research group, the root canal orifice was first probed with a specific instrument, and then ultrasonic working instruments were used to remove the calcified tissue under the direct view of the microscope. The root canal was gradually dredging using C-pilot files or a 8 manual K file combined with a small amount of EDTA gel.
If the calcified part was located in the lower segment of the root canal or the entire root canal was calcified, specific tools were used to open the middle and upper parts of the canal. The ultrasonic tip was then utilized to remove the calcified tissue in that area.
After complementing the root canal dredging, the canal were prepared using nitrile rotary files. Finally, the warm gutta-percha vertical condensation technique was used to fill the root canal in both groups. Now let's move on the results of the study. We will be discussing the comparison and findings between the two groups, the research group and the control group.
First, they analyzed the patient data to ensure the accuracy of the experiment. Factors such as age, BMI, gender, smoking, drinking, and eating habits, sleep patterns, and tooth positions, as well as calcification site and ethnicity, were collected, and the statistical analysis showed no significant differences between the two groups. indicating that the patient characteristics were comparable.
Next, they evaluate the therapeutic effect of the treatment. In the research group, 5 patients had ineffective treatment, resulting in an overall response rate of the 92%. In the control group, 14 patients had the ineffective treatment, resulting in overall response rate of the 79%. The comparison between the groups showed a higher overall response rate in the research group.
Finally, they compared the incidence of adverse reactions. The comparison between these groups revealed that a lower incidence of adverse reactions in the research group.
Now, let's delve to the discussion part. The formation of the root canal calcification is a natural response of the dental pulp tissue as the teeth age or due to factors like inflammation and cavities. This calcification leads to thickening and obstruction of the root canal and make it challenging to perform the root canal treatment effectively.
Root canal treatment is often difficult due to the complex structure of the mouth and limitations in the tools and visibility during the procedure. It causes discomfort for patients and can be expensive as well. Therefore, finding a safer, more effective, and convenient treatment method is crucial to provide better care.
In this study, they compared 2 treatment approaches, the traditional C-pilot files and a combination of the microultrasound with EDTA and C-pilot files. The group using microultrasound plus EDTA showed better clinical outcome and higher success rate in dredging root canal calcification compared to the traditional approach.
They also observed that the group using microultrasound plus EDTA had shorter dredging time and significantly reduced pain compared to the traditional approach. These findings highlight the potential of using microultrasound plus EDTA for root canal calcification treatment.
As you know, the traditional methods relies on manual exploration using small stainless steel files, which requires experience and precision. The risk of the damage or breaking the files into the canal adds to the challenges and burden on the patients. This could explain the lower success rate, longer procedure time, and increased pain reported in the traditional approach group.
To improve treatment outcomes, advanced imaging techniques such as CBCT can provide a clear visualization of root canal curvature, calcification position, and degree. CBCT assisted treatment allows for precise root canal preparation and reduces the chances of missing canals.
Additionally, using minimally invasive microscopic instruments have shown benefits in identifying calcified lesions and improve visibility. Combining ultrasonic instrument with the microscope enables precise removal of the calcified deposits, enhancing the success rate of the calcification removal and overall root canal exploration.
They improve root canal dredging effect and reduce adverse reactions observed in the microultrasound plus EDTA group, support the safety and efficacy of this approach. However, it's important to note that this study had a short experimental cycle and a limited number of cases. So, further research is needed to evaluate long-term patient outcomes.
Finally, let's talk about the conclusion of this study.
The combination of EDTA plus C-pilot files with microultrasound approach has several benefits. It significantly improves the success rate of root canal dredging, meaning better outcomes for patients. It also reduces the time needed for the procedure, making it more efficient.
In addition, using EDTA with C-pilot files and microultrasound improves patient comfort during the treatment. Patients reported experience less pain and discomfort compared to the traditional methods.
Another advantage is the reduced incidence of adverse responses or complications. This means a safer treatment experience for patients.
Overall, this study demonstrates that the combination of the EDTA, C-pilot files, and the microultrasound is an effective and reliable method for treating root canal with the calcification obstruction. Well, that's it, friends. Thanks for joining us today. We hope you learned something new.
Sure, and don't forget to join Paper Biopsy family and never miss a moment. Goodbye.